Good afternoon, everyone, and welcome again to another one of our community health talks. This health talk is very significant because we're doing something different. This month is Native American Heritage Month, and we have the privilege of having some of our community leaders here represented on this WebEx that's going to share very important information about Native American heritage as it relates to the health issues that kind of come along with their community. So without further ado, I'm going to ask Dr. Campbell if she would introduce herself.
Well, good afternoon to everyone. My name is Dr. Marie Campbell, and I am a family nurse practitioner here at Southeast Primary Care, and I am a resident of St. James Community, Lake Waccamaw, North Carolina, and a member of the Waccamaw Siouan tribe. It is my privilege to be with you this afternoon on such a special occasion to celebrate my heritage as a Native American for Native American Heritage Month. And I want to again thank Jeremy for allowing us the opportunity to be able to speak about our heritage and why it's so important that we be recognized within our community.
Thank you. LaWanna.
Good afternoon. My name is LaWanna Bailey. I am also of the Waccamaw Siouan tribe. I reside in St. James, which is a small community outside of Lake Waccamaw. I do work with Southeast Primary Care in the call center, where I've been employed here for 4 years.
All right. Welcome, LaWanna. Thank you. Chief Jacobs.
Thank you.
Hi, Chief Michael Jacobs, Chief of the Waccamaw Siouan tribe. I reside in Saspan Council Community. And again, it is a privilege on behalf of Brother Jeremy in Columbus County for having us here on this Native American Heritage Month, something that has really been a blessing since we fought long and hard to get it. Thank you.
Thank you all again once for joining with us. Columbus Regional Healthcare System we view diversity and inclusion as one of our top priorities here at this organization. And it's a privilege to have you all take part in this conversation. So I'm just going to ask you a few questions and just feel free to kind of jump in.
Okay.
I think everything we ask is helpful to our community to be informed in regards to certain things that you all as Native Americans deal with. So what is Native American Heritage Month and what does it mean to you?
You want me to go first, or do you want to go first, Preacher Mike, out of respect to our chief?
You can go ahead, Sid.
Okay. Well, Native American Indian Heritage Month means to me is a time and an opportunity that we have as individuals to celebrate our heritage as being Native Americans. As you know, that we are still here and we are still in existence, and there are 8 tribes that are located in North Carolina presently. And I'll let Chief, out of respect to our chief of our tribe, I will let him allude to that as well. I'm sorry about my phone.
We'd like to add to that, Dr. Maria, Native American Heritage Month, since it was started here in the state of North Carolina to recognize the indigenous population that lives here within the state, it gave us the opportunity to teach and to recognize the whole story of our history. So many times in history, we only hear one side of the story. But now this gives us an opportunity for a month to actually recognize the whole story. Native American point of view, as well as the settlers' point of view when they came to this great nation.
Okay, so I would like to say that, it is a month, a time that is designated for our people, an opportunity to teach others, not only Native American people, but non-natives as well. I think sometimes people are often confused that, this history, our heritage is solely for us, but we want to educate others as well. We want to educate ourselves, of course, but we want to educate non-natives. And, that's a part of us. We want to include others, and that's why we often celebrate and often things are pretty much open to the public. It's not just for, solely Native American people.
And with that being said, I would just like to allude to add to what Luana was saying. As you all know, we usually celebrate our annual powwow, which is usually in October. But as a result of the COVID-19, that was canceled, as many events have already been canceled. And so that is the time where we do invite others to the pub, others in the community, other surrounding communities, the public, because we have a school day. We invite others to come out and participate in our heritage. And it's usually a 2-day process where we have 2 days of celebration where there's arts and crafts. The first day is a school day where we have history stories being told. Even our chief of our tribe, Preacher Mike, as you know, he even speaks during that time as well. And he's visible. We have a parade, and we have a lot of festivities during that time. And we even have our culture with our foods that are being served at that time as well. And it's also an opportunity where you get to see us in our regalia.
Yes.
Yeah. So thank you. Speaking about the powwow, I was going to ask you a question regarding that. Where did it originate from, and how important is it to your culture?
I'll let Preacher Mike take that.
Our tribe have been having our gatherings ever since we've been placed on this earth by the Creator. But for 50 years now, we celebrate our annual powwow, which is, like the sister was saying, it's the opportunity for us to give to the public our heritage and to teach others where we come from and where America started.
It sounds like it's something that everybody can take part in. It's not just designated for Native Americans.
Right, a powwow is just a big homecoming.
It is.
It includes all the surrounding tribes and all the people, public. Anybody can come and take part in it.
Yeah, I told Dr. Campbell, if you can put me on record right now, I plan on being at the one next year. I look forward to participating next year.
Well, I would just allude to that too. I'm 53 years of age, and I've been to every powwow since I've been born. And that's how long I know it's been in existence, way before that. Because a lot of our forefathers that have gone on, like for our previous chiefs, like Roscoe Jacobs, of course, very instrumental in when I was growing up as a child, even working at the tribal ground myself in the youth programs. The daycare. I mean, a lot of, like I said, our forefathers, Miss Maggie Wells, Miss Shirley Freeman, who's still living, thank God. A lot of our mentors that have really shaped, I can say for me, who have shaped and been very instrumental in my life growing up as a Native child.
I have another, moving this conversation along. So oftentimes we notice a lot of folk going back and forth from using the term Native American or American Indian. Can you kind of expound on that? Like, which is preferred and why? Is that something that we should be sensitive to? Like, can you kind of expound on that?
Well, I'll say that American Indian, using the Indian word, it refers back to Columbus when he first came to the Americas. And it was giving him credit that he had discovered America. He was lost. According to his logs and everything, he thought he was in the Indies. So he called everybody he saw Indians. And as time has went on, we've got more accustomed of Native Americans, which we are. We're Native Americans. We were here thriving with our own government, our own society, our own language, our own community. Everything, was thriving when the settlers came. So we sort of look at it like, in teaching the whole truth. Go ahead and tell the truth about it. He was lost, and there were some friendly Indians that helped him survive. Yeah.
Thank you.
Which goes back to my point that we're still in existence.
Absolutely.
I think most of the time when people ask, if clearly they don't know what our race is, I generally say, that I am Native American opposed to Indian.
Okay.
And I'd just like to just add to that too, that a lot of times within our area where we live at in Columbus County, there are a lot of us, my fellow Native Americans are misconceived and perceived differently. They're perceived either they're mixed or they're Black or they're not of some other descent rather than Native American. Native American never comes across their minds. And I'd just like to say that, just to allude to some of the health disparities, as you know, that within Native Americans we have the highest incidence for development of diabetes, hypertension, obesity, suicide, alcoholism is very high. And so those are issues that are very important to me in healthcare and helping my fellow man and even the patients that I serve within the area, because those disparities are really high. There is a disparity of those health issues within Native Americans because we have a lot of those disorders and we're high risk for those illnesses. So I think it's very important that as a community that we are knowledgeable of the different cultures that exist, and particularly the Native American culture, so that we can better address these disparities and meeting the healthcare needs of Native Americans or any other disparity, any other ethnic race.
So Dr. Campbell, you brought up health disparities. So what are ways that our organization, Columbus Regional Healthcare System, and other organizations, around here, like what are ways that we could partner with the Native American community to kind of resolve some of these disparities?
Well, certainly, just as you're doing today with having open communication, first of all, with our chief, Preacher Mike Jacobs, who is very willing to be accessible or to discuss any issues that you may have or the needs of our people. Certainly utilizing the tribal grounds. We have a tribal ground that's located in Buckhead in Bolton, North Carolina, in the community called Buckhead, North Carolina. So it's the tribal ground. We have a center there, the tribal office, and we have, there are classrooms there that we could provide classes there for Native Americans. If that's not large enough, certainly Preacher Mike would be able to allude to help us with finding a facility where we could do classes to promote healthier eating, to just bring health topics to the community. Even with Columbus Regional Healthcare being more visible. I know that Columbus Regional is visible at the community agricultural fair. Don't know what happened. Sorry. But that, you're visible. Columbus Regional Healthcare, I've seen it doing multiple fairs. But why not even do something during our annual powwow? Have a table set up to let the community know that Columbus Regional Healthcare is supporting the powwow. To be visible in the community, to let the community know, hey, you are a part of us as well. And to include us in activities and any events, possibly, I'll give you another example. Diabetes, as I said, is one of the leading causes of a health disparity in Native Americans, as you know, anyway, and hypertension. We could sponsor a hypertension clinic. We could do a diabetes screening clinic there, offer diabetes screening, educational tools there for those particular illnesses. There's a variety of things that we could do. So I think what we need to do is just take an active part and become active within the community and be visible. And again, have the open communication and bring programs to the communities. And with that being said, I'd just like to say this because our Waccamaw tribe is very large. I think we're approximately 2,600,000. Is that 2,600, Preacher Mike?
2,600.
2,600. So that's 2,600 Native Americans, if I remember correctly, with the census that was done last in 2014, right, Preacher Mike?
Right.
Okay. So with that being said, that encompasses, there are two communities with the Waccamaw tribe. You have the Buckhead community, which is a little bit, I'm not for sure as far as the numbers and which community is larger, but that doesn't matter because we're a whole as a people.
Right.
And so you have the St. James community, which is in Lake Waccamaw, and then the Buckhead community, which is inclusive in Bolton, and not only Bolton, but Council as well. And then we have Native Americans that are in Chadbourn, North Carolina. I don't want to exclude them. Excuse me, my mic was flying.
Sure.
But we have Native Americans in Chadburn as well. For the Waccamaw Siouan, it's not just in the Buckhead community or in Bolton. So you got to remember the surrounding communities, because you have Native Americans in Columbus County, Bladen County, and also, as I said, on the eastern counties as well. And to elaborate on that, you have the different tribes. There are 8 tribes in North Carolina. You have the Waccamaw Siouan tribe, which is the tribe that we're speaking from. You have the Lumbee tribe that's located in Lumberton, North Carolina. You have the Coharie tribe that's located in Clinton, North Carolina. Then you have the Hollow Salapino tribe that's located in Ahoskie. And help me, Preacher Mike, because I'm missing some others, so I don't want to leave any out.
You have the Meherrin tribe,
Yes.
the Occaneechi. That's the Halawasa Pony, and you also have the Saponi. And then you have the Triangle Triad, which is the organizations. We have 2 organizations, I believe, in North Carolina that's recognized by the state. And the Eastern Band of Cherokee also.
I just want to make sure we include all of them. I didn't want to leave anybody out.
So Preacher Mike, I'm noticing that they call you Preacher Mike, Chief Jacobs. Can you tell me about?
Everybody loves Preacher Mike.
I hear that. I hear
He is
that.
The man
loved.
of God first before the
Yes.
chief.
That's
So
right.
Preacher Mike, can you tell me about the spiritual beliefs that are practiced amongst Native Americans, and specific to your tribe?
Our tribe is predominantly Christian with Native understanding. And when I say that, this is what I mean. When Christianity first came to the Americas, it was brought not in the correct manner. Native American people were made to not speak their language, made not to practice their culture. They were told not to carry out their native activities, of family and community, because it was contrary to the word of God. But we found out through the Spirit that this is not so. Native understanding is knowing that all things have a spirit and a being about it. All animals. We don't worship but the Creator, one God. We believe in that, and we believe in honoring everything that the Creator has made. So we're mainly a Christian practicing people. We do have some folks that are trying to go back to some of the original beliefs, but we try to encourage them to realize that even before the white man came with the Bible, we still had the Spirit. And the Spirit taught us in one Creator, one God. And we believe that.
And Dr. Campbell, speaking of beliefs, can you tell us about the Native American practice as it relates to medicine in healthcare? Like, are there any specific beliefs that you all have as it relates to how to be treated in regards to healthcare? Like, when you come into the hospital, are there certain things that we should be aware of when we're providing care for Native Americans?
With the Native Americans, yes. Certainly, you need to recognize our culture. That's the first thing, because that's very offensive to us as Native Americans when we come into the emergency room. If you're not even recognizing the culture or recognizing that we're even Native American. As I said earlier, a lot of times when we come into the emergency room, or it's just all understood. I mean, they may just assume and say, "Oh, well, they're Black." They don't even consider, even ask what their culture or ethnicity it is of an individual. And as far as beliefs, I mean, as Preacher Mike has just alluded, as far as the spirit is concerned, we are spiritual beings, and we do believe in the Creator, first of all. And as far as prayer is number one in our lives as a Christian and as to the Creator. And there, in the years past, before we even had medicines, there was a lot of folklore medicines that we did in terms of like the medicine doctor that would create medicines for us for the common colds or even for a sprain. I remember as a child growing up with my grandmother, Preacher Mike may even remember this, that if you had a sprain, I know my grandmother would put a collard leaf and a mixed with clay, and it would have some other type of, I don't know if it was vinegar in it or what, but anyway, and she'd wrap that around my ankle. And you might laugh at this, but believe it or not, it worked. So we have, in our culture, we still believe in our herbal medicines, with taking those and herbal treatments and home remedies that we even goes way back in years past. I'm reaching back to, I know that and even Luana's great grandfather, I don't know if you know this, Luana, but he was the medicine doctor for years in the St. James community, going way back, and I can't remember, it's on his tombstone.
Yes, ma'am.
But anyway, he was the medicine doctor. And so we take very pride in our culture and our beliefs as far as treatment. We believe in the creator, and then a lot of us still believe in those herbal medicines.
We do.
And Preacher Mike, you can allude to this too, elaborate on that, where I know that they were doing the native herbs and healings at the tribal ground. I think they're still doing that.
Yeah. Yes, ma'am. We have Sister Darlene and them. They have a healing garden, which they have reintroduced some of the native healing plants and things back to the tribe, and they're carrying it out daily. They got a lot of our young people involved in teaching them some of the healing methods, that have been common to our people for years and generations. And I want to say this also, you asked the question, what could Columbus Regional do to better serve the tribe, to help the tribe? I believe a good start is changing the face of the hospital, in which you've done by incorporating some of our people on the staff. When our folks come to the hospital and they see a familiar face, it gives them a sense of a relaxation or trust. And our people have long time not trusted the hospital because of treatment in the past, So it's really a great opportunity and a change to see familiar faces when we come to Columbus County. I'm extremely proud of our folks in the medical field, Dr. Marie, Sister Luana, and many more. I'm just proud of them, and I thank God for them every day. And I appreciate Columbus Regional and the management for seeing the need to employ a community of people that looks like our community, and not just one race or one group, but that it incorporates everybody.
Absolutely. And I agree with Preacher Mike. If you come into a facility and you see a familiar face, that can bring comfort to any patient. I know oftentimes whenever you do have a medical concern, sometimes it is hard whenever you go in and, you don't feel comfortable.
And I would like to just add to that too, and I would just give you an example of that. I had an example of that today. And due to confidentiality, I cannot say the patient's name, of course, but I had someone and he came, and I'm giving you this as of today. The patient came in, and he was thought of as possibly that he was an African American. But when I saw that patient, he was Native American, and he was so glad when he saw me. Mm-hmm. So it does make our culture, when we come to the hospital, to have more diversity. It does make you feel welcome. It does make you feel that you can have trust, as Preacher Mike said, with the care that you're receiving here at Columbus Regional Healthcare. And I would just like to allude and just say that I would like to see more diversity here at Columbus Regional Healthcare.
And may I add, oftentimes, what is not known is misunderstood, and it's okay to ask, if you're not sure, I think it's better to ask than to assume, and that will not offend us, we just want to be recognized for who we are. And we are Native American people. Whenever you are going to any facility, whether it be Columbus Regional or any other medical facility, it is totally okay to ask, okay, may I ask what is your race? Just don't assume, okay, you're white or you're black or you're Hispanic, We take pride in who we are.
And may I add on that, it really helps with our statistics when we do our census and different things concerning the medical field and the health care of our people. If the health facility don't get the race recorded, then it don't reflect the right information.
That's
How
correct.
to do our research, what we need in helping our people. So this is important. I really believe.
Absolutely.
And that is very true, because even with the COVID-19 pandemic that we have presently, a lot of the data I have asked for I had requested the data for to see how many the statistics on the COVID exposure, and they had it divided, and the statistics for male and female, African American, Caucasian, Latinos. I did not see Native American represented, but that goes again with the disparity. This is not only just a Columbus regional issue. This is a national issue, nationwide. If you recall, even with the election that we just came through, it was on CNN, and they had all the races listed there. They had the African Americans, the Caucasian race, the Latinos, and listed under that was something else. So Native Americans was not even listed, but something else. And I thought, what is something else?
Absolutely. And here at the hospital, we are very aware about representation being important across the board. And I'm just grateful that you all have been willing to come here and share your story, because we've learned so much in this short period of time about Native American culture. I'm just excited that we will continue to partner with you all to go to your communities to provide the support that you all have actually lifted up here on this WebEx. So thank you all again, Dr. Campbell.
Thank you.
Thank you.
Chief Jacobs for joining us today.
And may I say one more?
This is not the end either. I feel like this is the beginning of
That's right.
a long-lasting relationship between us in the tribe. So we're grateful for you all. Thank you again.
Jeremy, if I could just say one thing, I'd just like to make sure that, again, thank you for acknowledging Native American Heritage Month. But this is not, I just want to make sure so that there's no miscommunication or concepts from this webinar, or is that this is not a race issue that we're talking about. This is just basically about our heritage and recognizing Indian Heritage Month. So I just want to stress that, so that because I know that in our nation today that there's a lot of controversy going on in terms of race, and with all different races, with Black, African American race, the Latinos, etc. But this is not any particular race, because we all belong to the Creator.
That's right.
We all are one people. So again, I want to thank you for recognizing Indian Heritage Month for us. And thank you for having Chief Jacobs come and Luana to be represented. And thank you, Columbus Regional, for taking the opportunity to recognize Indian Heritage Month. Thank you so much.
Thank you.
Thank you again for joining Community Health Talks. We look forward to sharing with you all pretty soon. Take care.
Okay, thank you.
Take care, Preacher Mike.